Well, Monday, 24 March marks World TB Day. Drug-resistant TB is a growing problem in South Africa. Out of nearly 500,000 South Africans who contract TB each year, more than 15,000 will be infected with multi-drug resistance TB, which means resistance to the standard TB drugs. Dr. Jennifer Hughes from Doctors Without Borders, that's Médecins Sans Frontières, works as a TB doctor in Khayelitsha outside Cape Town. She joins us now live from our studios in Cape Town. Dr. Hughes, thank you very much for your time and thanks for joining us. I'm particularly fascinated by one of the statistics that your organization has shared with us when we're preparing for this interview, that the Western Cape somehow has the toughest strain of this of TB. Do we know why?
I don't know if it's the case that the Western Cape has the toughest strain of DRTB in South Africa. It's just that the Western Cape have a very good system of diagnosis. So potentially we're just diagnosing more of it than other provinces in South Africa, but it's likely to be around the rest of South Africa as well.
Has the highest burden in the Western Cape? Is it because of the living conditions there?
So certainly the living conditions contribute to the transmission of drug-resistant TB, and that's the problem, is that DRTB is mostly transmitted. So it's not because people are not finishing their TB treatment because they're bad patients, it's that it's being transmitted from one person coughing the drug-resistant TB into the air and somebody else breathing it in. So certainly living conditions contribute.
How come the gap between the diagnosis of DRTB and the treatment in South Africa is widening? What's going wrong?
Sure, that's what we're seeing in recent years, is that we're diagnosing more drug-resistant TB because of better diagnostic techniques which are being rolled out across South Africa, but we're not seeing that same amount of people starting on treatment. And I think what we really need to be concentrating on is strengthening our systems, our healthcare systems, so that people are able to go to their local healthcare facility within their community in order to access the right treatment. If we depend on people having to go to specialist centres to access their treatment, then we'll never get enough people on treatment as we need to.
So decentralized management of this is the way to go?
Exactly. Decentralization to grassroots level, to primary healthcare centres, where the same places that people can get their normal TB treatment, they need to be able to go there to get their drug-resistant TB treatment as well.
Now, there's a lot of stigma around TB in South Africa today because of the link with HIV/AIDS. Do you think that contributes to how people embrace or not the treatment of TB?
Absolutely. Stigma plays a large role, and a majority of our drug-resistant TB patients in South Africa are HIV infected. But just because you're HIV positive doesn't mean you're going to get drug-resistant TB, and just because you have TB or drug-resistant TB doesn't necessarily mean that you're going to also have HIV, but certainly the two are linked.
Yeah, but how do you manage it? I mean, the former President Nelson Mandela said once, we cannot fight AIDS unless we do much more to fight TB.
Absolutely. We need to be getting people on treatment. That's the key. We need to find the drug-resistant TB that's out there and get these people onto treatment, because in the end, the transmission is from people who have the disease inside of them but are not being treated properly. So until we can get more than 80% of our diagnosed cases onto treatment, we're still going to have a problem with the disease just being transmitted from one person to the next.
Dr. Hughes, last week I interviewed a member, an official of SANTA, the National Association of Tuberculosis Association in South Africa, and he said one of the problems that exists currently in the treatment of TB is that they're still using old type of medication and it takes very long. One would have thought with technological advances that pharmaceutical companies, researchers today would have found a more effective, efficient, faster way of treating TB. What are people saying about it? Is your organization doing anything to help with this?
We are. So we are trying to find new drugs or drugs that haven't been used commonly for drug-resistant TB in order to treat this disease. But I think the problem is that the people who are affected by the disease are the ones who cannot pay for it. So there is no incentive to develop new drugs for people who can't pay for them. But what we're doing in Khayelitsha is really trying to access drugs which we think or we hope will be effective in order to give people a chance of cure. And that's really where we need to be going.
Is that why
our treatment regimens are terrible?
Is that why you've come up with this manifesto of DRTB manifesto? You are highlighting specifically this issue.
Absolutely. So the manifesto states that we need to find the drug-resistant TB that's there and get people better treatment. What we need are better treatment regimens so that people can take them, so they don't have to go to their clinic every single day for 2 years to take a treatment regimen which is only effective half of the time.
Okay, thank you very much. That's Dr. Jennifer Hughes from Doctors Without Borders.